The purpose of this video is to measure and assess the lumbar and thoracic spine range of motion. The first I'm going to start with is the lumbar flexion and extension. So I'm going to have the patient cross his arms over his chest. Good. I'm going to put the fulcrum at the lateral hip. The stationary arm is going to be pointed down towards his fibula, and then the moving arm is going to be parallel with his torso. So I'm going to ask the patient to gently flex forward as far as he can go. Good. So that would be his flexion. Go ahead and stand back up. And then going back to neutral, I'm going to ask him to gently extend backwards as far as you can go. Great. Go ahead and relax. And that would be for extension. For lateral flexion, the patient is going to face the back wall. You can put your hands at your sides. So the fulcrum is going to rest on the sacrum. I'm going to keep the stationary arm straight up towards the sky. Some people point directly downwards, but I think it's more comfortable for the patient to have it directly upwards. And then the moving arm is just going to follow the spinous processes. So what I'm going to ask the patient to do is he's going to keep his hands towards his sides, and then he's going to try to touch this side of his knee, going with the right side first. Yep, as far as you can go. Good, and come back up. And then the other side. Good, and relax. Lastly, we're going to assess rotation. So I'm going to have the patient sit in this chair. You can sit facing that way. And I'm going to have you cross your arms over your chest. Just like how we did with cervical rotation, I'm going to put the fulcrum at the top of the patient's head. The stationary arm is pointing back towards me, and I'm going to follow essentially the center of the patient's chest. So I'm not going to look at his nose because he's probably going to over-rotate with his neck. So I want you just to rotate the upper part of your torso. So turn over towards me. Good. So I'm basically just following the sternum. Go ahead and face forward. And then turn towards your left. Good. And again, just being parallel with his sternum. Go ahead and look forward. So that's how you would measure the range of motion. If I wanted to do it passively, I'm going to ask the patient to lay on the table on your back. And you're going to completely relax. To measure lumbar flexion, you're going to grab the patient's legs and bring it up towards his chest, noting any pain with that. For extension, I want you to lay on your belly. And what I'm going to ask the patient to do is put his hands towards his shoulders. You can put your hands towards your shoulders like this. Yes. I want you to press up, keeping your hips on the table, but you will not use any of your back musculature. So you're only using your arms to push yourself up. Good. So this would be passive lumbar extension. Go ahead and flip on your back. For lateral rotation, I'm just going to again bring his hips up to 90 degrees and 90 degrees of knee flexion, and I'm just going to bring his hips over to the side. So this is for lateral flexion. If I wanted to assess rotation, I would just bring his knees over his hips in this regard. So that would be for passive range of motion. For resisted range of motion, I'm going to have you in like a sit-up position. Yes, can you cross your arms over your chest? Great. So for resisted flexion, I'm just going to stabilize his knees and ask him to do a crunch. Before he does that, I'm going to provide resistance over his hands where he crossed his arms. Go ahead and push up. Great. Go ahead and flip on your belly. For resisted extension, I'm going to ask the patient to do a Superman. So keep your arms up towards the sky. Yep, and then lay all the way flat first. I'm going to stabilize the sacrum. Anytime I stabilize the sacrum, I always put the base of my hand directly on the sacrum with my fingers pointing upwards. I'm going to provide resistance on the back of the shoulder, so go ahead and push up. Great, and then relax. That would be resisted extension. Go ahead and flip again on your side, actually. Do you know what a side crunch is? No. Okay, so what the patient is going to do is do a side crunch up. So can you put your hand behind your head? Yep. Keep your shoulders square, and I want you to crunch here. Good. If he can get up into that position, usually gravity is enough to provide enough resistance, so go ahead and relax. If he is able to do that without any problem, go ahead and get back in that position. Yep, so relax. I'm going to just stabilize his hips using my forearm, and then I can resist the crunch up, so crunch up. Great, and then relax. Lastly is rotation, so he's going to again get back into a normal crunch position, so on your back, bend your knees. Great. And instead of just crunching directly anterior, I'm going to ask him to crunch anterior with a rotation. So I'm going to stabilize his knees, and I'm going to again provide resistance. So he's going to crunch over to his right. So crunch up. Great. And then relax. Remember, you always want to do this one and the lateral flexion bilaterally.